Prostate cancer has been around forever, but the treatment has evolved over the course of the last 10 to 20 years. There's data emerging that shows that brachytherapy is better than just treating with external beam radiation alone. There's emerging data showing that in the highest risk cases, it's probably the best treatment available. Brachytherapy is a way to deliver radiation at the source. Instead of treating from the outside in, you're treating from the inside of the tumor out, so you get the highest dose, the highest killing of the tumor at the very core of the tumor. It's the best way to deliver a dose of cancer radiation to the cancer and with sparing the normal tissues at the same time. We started doing it nearly 10 years ago. The current method of delivering the brachytherapy about 10 years ago. It is something that is special to us because we took a particular interest in it. We saw the benefit to the patient in terms of convenience and in terms of increased chance of cure, and really pushed the development of the skill at our center. And so we pioneered it in the state. We have a high volume of patients that are treated. We have a lot of experience. We work very closely with the urologists, both the referring urologists and as well as the urologists that help us deliver the treatment to make sure that every patient has a plan that's individualized for them, whether it be a single brachytherapy implant combined with external beam radiation or 2 brachytherapy implants, so that they get the best chance of cure for them, but while minimizing any toxicities or side effects. Multidisciplinary conferences are great. They allow all the physicians who are involved in the care of the patient to be in one room together to discuss the plan from the beginning. So as the patient progresses through the treatment course, we don't have to ask as many questions. There's not as much uncertainty. The patient knows from day one what they'll be doing for steps A, B, C, and D, and that all the providers are on the same page. There's some obvious benefits of doing clinical trials. One is that we increase our knowledge, we increase our ability to fight cancer in the future, but also for the patients who are involved in clinical trials, there's strong data that shows that patients who are involved in a clinical trial have a better outcome, both in terms of curing the disease or avoiding side effects. An individualized treatment plan comes from the Multidisciplinary Tumor Conference. When we present that to the patient, we are confident that we know that everyone is in agreement with the plan, that we're giving them the best care possible. We're offering them a clinical trial if it's available, and it helps the patient to be calm and assured that they're getting good care when all their doctors say the same thing and all the doctors are happy and content with the treatment that's recommended. The John Slaughter Cancer Center is a great center. It serves the patients well. It gives me the tools that I need to treat patients, to collaborate closely with the referring and the other treating physicians, and to have a concise and cohesive unit. Any of us on the team, whether it be a surgeon, a medical oncologist, a radiation oncologist, have the same goal for the patient. We attend the same meeting together. We know the goal. And so any of us can fill that role as that primary contact person or cheerleader for the patient or that shoulder to cry on. And so it's really a blessing to have a group of people that are working so closely together that can be there for the patient.